Hi, my name is Dr. Stephen Beck. I'm a board-certified plastic surgeon at the Center for Cosmetic Surgery in both Denver and Golden, Colorado. Tummy tucks are a very desired operation in cosmetic surgery. Drains are probably the biggest complaint people have after having tummy tucks. The drainage tubes are irritating, they increase the risk of infection, they are stitched to the skin, so if the drain pulls on the skin, that can be painful. People fear having them pulled out, and traditionally we have always used drains, but recently there's quite a bit of evidence that shows that you do not need to have drains with tummy tucks. I personally have not been using drains with my tummy tucks now for 8 years. I do about 300 tummy tucks a year, so that's close to 2,500 people that I've not used drains on. And who's a candidate for this? In my opinion, everyone who's a candidate for a tummy tuck can have a no-drain tummy tuck. What a no-drain tummy tuck is where instead of using drains, you actually stitch the layers back that you just separated in order to achieve the tummy tuck result you're looking for. So when you do a tummy tuck, you're separating the skin and the fat off of the muscle. You're going up all the way to the chest bone from down below, and you're separating the layers so that you can pull the skin and the fat down and tighten the tummy and make it look more attractive. Traditionally, the drain was put in there so that fluid did not collect between the two layers. This makes sense, and during that time that the drain is in, no fluid will collect, which is the tendency for the body to do when there's a space created surgically. But there's a better way to handle this, and that is that you can actually stitch the layers back down with what we call sequential tension sutures. And what these are dissolvable sutures that you put on the back side of the skin and the fat and tack it down to the muscles so that you close off that space and so there's no place for fluid to collect. These sutures, you don't feel them, they dissolve so you have nothing permanent in you over time. And what it allows for is less tension when you close the tummy tuck at the bottom. So actually, besides allowing you to avoid drainage tubes, it also allows for a better scar because it keeps pulling off of the resulting scar on the surface. The no-drain tummy tuck has no downsides, in my opinion. The no-drain tummy tuck reduces your risk of infection because you don't have a hole with the drain going in. It reduces your fear of having the drain pulled out. It reduces the discomfort associated with the drain while it's in. And believe it or not, it reduces the fluid collection, which is called a seroma. How would this be? Well, when drains are taken out, generally at a week, some plastic surgeons leave them in longer, but when the drains are taken out, sometimes those layers have not healed together. And so fluid can still collect. And generally, it's about 10% of patients that will actually have some fluid collect after drains are removed if these sutures are not placed inside. That's a lot of people. It's about 30 people a year if you're doing 300 tummy tucks a year. When you do the sequential tension sutures, these last several months. Plenty of time for the layers to heal together so there's no place for fluid to collect. So actually, in the long term, you're going to have much less chances of having fluid collection besides all the other benefits of not having the drains. No drain tummy tuck is a big reason why people are considering tummy tucks now that would never have before. After reading all of the frightening remarks about drains and how distasteful they are to people all over the internet, now you can have a tummy tuck without drains.